Hello, I'm Dr. Kelum Pelpola. I'm a consultant physician and geriatrician. So today we are talking about geriatric medicine. So what is geriatric medicine? So geriatric medicine is a new specialty which has come up to talk about being a physician for elderly people. So why do we need a separate specialty for them? There are a lot of reasons. So we know that when we get older, all our systems go downhill. It could be the heart, it could be the kidneys, it could be the liver, it could be your lungs. So compared to a younger person, there are chances that you are dealing with a few other issues. Say for example, you may be dealing with a heart problem and a kidney problem and a lung problem all together. So when you do all of that, the way that you treat each and every system may need to differ. So in a younger person, most likely you will see only one problem. It could be something related to the heart or something related to the lung. But in an older person, you see all those systems involved. So that's one difference. At the same time, you see a lot of our older people have a lot of medicines. I have met some patients who are on about 25 medicines a day, and that sometimes tends to happen because we see each and every specialist for each and every disease. Say for example, along the years we see one specialist for the heart, they will have probably 2-3 medications. Then if you have diabetes, that's another 3-4 medications which may get added. If you have a lung problem, another few medications, maybe a few inhalers which get added, and so on and so forth. These on keep on adding, and sometimes you realize that due to various practical realities and circumstances, there is no coordination between the original doctors who are treating the different organs. So then what happens is these medications pile up, and in the end you are wondering whether all of these medications are required, because all of these medications can give specific side effects. There are certain drugs which may lower your blood pressure a lot. Sometimes you may find certain drugs may make you fall. They may cause problems with your blood sugars. So all of these needed to be taken into account. So geriatrics has developed so that all of these things happen where there's a central point or a central clinician who would look at all the systems and try to decide what we need to do for the betterment of the patient. Obviously, if there are certain organs which are involved, we need to get those consultants and all on board. But at the same time, we need to realize what are the best things for the patient, how do we go forward, how do we increase their quality of life, and what are the most essential medications, and how can we reduce any kind of side effects that they can make. So at the same time, there are some specific things in geriatrics. So you may have heard that when a doctor gives a medicine, you call that prescribing. But in geriatrics, you see whether you can de-prescribe things. That's the reverse of prescribing. You try to see whether you can do without certain medications. That's not to say that we need to stop all the medicines, but we need to rationalize each and every medicine to see whether they are absolutely required and whether they are not giving any side effects which are harmful to the patient. At the same time, in geriatrics, we have some specific things which are specific to old age. One thing which we regularly see is things like osteoporosis, falls, then there can be mobility issues where people cannot walk as they used to, memory related problems, then problems related to incontinence of urine, incontinence of stools. So if you look at all these things, you may realize that this is associated with wear and tear of different organs of the body. So most of these things are associated with that. Even things like memory can be due to the wear and tear of certain aspects of the brain. So that's why geriatrics has developed as a specialty in a lot of other countries. It has come to a certain level where in certain countries where they have separate accident and emergency services for geriatric patients. So these are the most important things that we need to realize. And if you see any of these problems in your mother or father or any one of the older aged individuals that you know of, please talk to your family doctor or another doctor to see whether they may benefit from seeing a geriatrician. Thank you.
Kings නිරතුරු විශ්වාසයෙන් ඔබ ළඟ රැඳෙන්නම්.